So thanks for taking the time to come and speak with me, David. I know most recently you were working as Chief Medical Officer over at Cochlear, which is famous for their hearing aid medical devices. What interested me most was the fact that you came from a clinical background as a practicing doctor into medical devices. Now that's a bit different to the traditional route of doctors looking to move into industry as they move into pharma. So what was your sort of thinking about, or your reasoning into going into medical devices rather than pharmaceuticals?
Well, Joe, thanks for the wonderful opening question. Yeah, look, well, I'd be the first to admit it was not based on any great consideration or, focus on the science. It was basically serendipity that ended me up in a small Australian company called Certex way back in the early 2000s, who had a novel, never seen before therapy for liver cancer, developed in Perth, Western Australia. And while it was a medical device, according to the US FDA, for all intents and purposes, it operated in the gastrointestinal cancer world. And so I ended up in oncology, but working for a never seen before medical device and device company.
Okay, cool. And was it always the plan to stay within oncology once you've sort of finished as a clinical practitioner?
Well, it's interesting you asked that question. When I was a junior doctor coming through my surgical training, I never really gave much thought to oncology. It was always a somewhat grim specialisation in medicine.
Yeah.
I saw a lot of patients unfortunately succumb to their disease over the years. And I think in the 1990s we had very few options that were effective. When I found myself in oncology in the 2000s, early part of the 2000s, new therapies were coming through at a rapid rate of knots, and the options, for example, in colorectal cancer exploded. And the survival rates for colorectal cancer at the time went from about 9 months out to almost 3 years, and it became a much more favourable prognosis for those folks who had that disease. And that was the case for all of the major types of cancer, or certainly most of the major types of cancer.
Yeah, and it's still very much a growing market, oncology, not as, very much the case within pharmaceuticals, but as well as medical devices. So, I mean, how do you see kind of the future of oncology progressing within both, would you say?
Yeah, I think we live at a very interesting time. We have made major progress. I think here in Australia, we have the dubious honour of being, the world champions at melanoma, for example, in terms of incidence, because of our environment. 5 years ago, that was a grim diagnosis to be in receipt of from your clinician, to be told you have advanced melanoma. That can't be addressed by a surgeon. Today, with the last 5 years advances in the immuno-oncology agents, we've seen a profound shift in the therapeutic options available to patients with melanoma. That doesn't exist in diseases like glioblastoma and pancreatic cancer and such. So we've got such enormous progress that we still need to make in these types of cancers. And I think as we better understand the interplay between genotype and phenotype, we will find more druggable, if you will, targets in these undertreated cancers, and that's where the advances will get made.
What made you want to move into medical affairs as opposed to something like clinical trials or a clinical trials position?
Yeah, look, it was certainly not by design.
Where do you see the medical device arena going for the next sort of 10 years? Where do you see the most growth or progression, would you say?
It has unfortunately been afflicted by a couple of quite significant disasters.